Government is now warning Kenyans against increased complacency in keeping strict adherence to public health protocols aimed at combating the spread of COVID-19. The result of which it says is a rise in new infections.
Now, 658 individuals have tested positive for the disease in the last 24 hours, and this represents 12% positivity rate from 4,912 samples tested, which is 2% more than yesterday.
Well, the country's caseload now stands at 44,881. Unfortunately, 7 more people have died, raising the toll from the virus to 832.
And now 105 individuals have recovered in the last day, and this brings the tally of recoveries to 31,857. Health CS Mutahi Kagwe now says government may be forced to make some tough decisions going forward. Jerusalema has more.
The seeming wanton violation of coronavirus containment protocols is now being blamed for the alarming surge in new infections being witnessed across the country. On Sunday, some 12% of cases were confirmed against the number of tests done, which is more than the 4% average reported just before containment measures were partially lifted.
We were going through for a couple of months, and then it was going to end. Sadly, I must tell my fellow Kenyans, be prepared for the long haul. This is not going to be a short-term issue.
Data released by the Ministry of Health indicates that 28 patients are admitted to intensive care units countrywide. Health Services Acting Director General Patrick Amoth said there are at least 991 admissions, up from 450.
If you also look at the critical care, we are in numbers below 10. As of today, again, we have 28 people in ICU, 10 of them under ventilatory support, 14 on supplemental oxygen, and 4 under observation. Again, telling you that we are getting more severe form of the disease.
The Emergency Response Committee observed that bars and other entertainment spots, as well as political leaders, have become notorious for flouting the protocols.
It is those same business people and business owners who pleaded with the president to reopen the businesses because of the hardships they were facing as a result of the closures. That once Jerusalema gets in, all measures go out. Please, can you dance Jerusalema keeping social distances? So we don't want this disease to spread so much that it begins to acquire political names. If Kenyans begin to fall in the streets, political leadership that is creating those gatherings must take responsibility.
As the country begins to pick up pieces of its economy from where it left off in March, the rising number of positive cases in the country and the number of deaths recorded has raised concerns, and the government has warned that if Kenyans do not continue to heed to what they're told in terms of measures to curb the spread of COVID-19, it may be forced to put in more stringent measures.
It's now between health and the economy, and health will always be the one that takes preference.
Counties that have shown a worrying trend in new infections, according to the response committee, include Kilifi, Nakuru, Trans Nzoia, Kisii, Kisumu, and Bungoma. Eunice Omolo, NTV, Nairobi.